So what you're basically saying is that the quality of the pregnancy is majorly dependent on the man.
Yes. A woman can be pregnant and not know. It can happen, but it is very rare. What I would say is that a cryptic pregnancy is a real pregnancy. A real pregnancy.
Okay. Some people say perfumes cause infertility. Some people say fragrance. Do these things have any effect whatsoever on fertility?
So this is a dicey question. Whether you have symptoms or not, and you are sexually active,
okay,
and you don't know your status and your partner's status, you check.
Can a woman sign her consent form? Let's say she's going for cesarean section.
Absolutely. The woman can and should sign her own consent form. For a lot of women that have abused emergency contraceptive, the first thing they say that the emergency contraceptive fail. The emergency you are trying to prevent now emerges.
So STI that a person had years ago can affect the person's ability to give birth now?
Yes, it can.
In your experience, how many Hebrew women have you delivered?
Every woman I've delivered is a Hebrew woman. Whether I delivered you from your tummy or from vagina, when a woman and a baby goes home healthy, in fact, Hebrew woman and Hebrew baby.
Can PCOS be reversed naturally?
You are trying to set me up.
No, I'm not.
You are trying to set me up.
I'm not.
Hi, I am Dr. Abosede Lewu. I'm a consultant gynecologist and I take care of women and girls.
Fake pregnancies. Is it possible that a woman can be pregnant throughout the length of her pregnancy and not know and even give birth?
Thank you for asking this question.
Okay.
Absolutely. A woman can be pregnant and not know. It can happen, but it is very rare.
How rare?
So let's say a woman being pregnant and not knowing midway, that's about 20 weeks, like 5 months into pregnancy, about 1 in 500. Now, a woman being pregnant throughout and not knowing till they deliver, that's like 1 in 2,500. So it does happen.
At least I know that one of the major signs of pregnancy is the fact that you'll miss your period. That's how you know you're pregnant. I know in Hollywood, you first vomit before they know you're pregnant.
Yes.
But in Nigeria, you miss your period. For 5 months, 6 months, this person does not have their period. Or do they have their periods while this pregnancy is still happening?
So we have 2 groups of women.
Okay.
Those that may be bleeding while they're pregnant, and some that they may miss their period. However, some women don't see their period normally. So let's say some women have some conditions, say let's say PCOS, and their period is already irregular. There's some women that in a year, they may not see their period more than once or twice. So if they don't even see their period, they don't think there's anything happening. Another group of women is the women that just had a child or a baby. You know, especially if she's breastfeeding. For some women, for months, even to a year, they don't see their period. Another woman is a woman that is close to menopause. You know, menopause is when the period has stopped, correctly. Yeah. But a woman that is preparing for menopause starts by having her period less frequently. So I'm not even giving those as examples, like women that are even on contraceptives that don't allow them see their period. Because the way some of these things work is that you don't ovulate, you don't see your period. So if you're already in a state where, and even athletic women, some of them, their periods are not regular. So if already your period, you don't see it all the time, missing your period may not signify what it means. That will not alert you the way to alert a woman that knows that every month I always see my period. So that happens.
So what you're saying is you cannot be pregnant and have your period at the same time.
I don't like using the term pregnant. You can be pregnant and be bleeding, but what you're having is not a period.
Thank you very much.
So that's what I do. So you can be bleeding, you can be that, but you're not having a period.
So any bleeding during pregnancy is not a period?
It's not a period.
I'm so glad you mentioned it. Because when it comes to that, we now need to talk about fake pregnancies that seems to have increased in this part of the world. They'll say, oh, you have a cryptic pregnancy. Don't let anybody scan you except it's me. And this woman carries the quote and unquote pregnancy for a couple of months and then a baby shows up from nowhere. How prevalent is it in Nigeria?
So while I don't have the exact statistics, I know it's happening frequently. And it seems like we're even having it more now, as if you're trying to get pregnant, is an expensive journey. And again, for a couple trying to have a child, they're in a vulnerable position, so people take advantage of them. And it always feels like this cryptic pregnancy scam meets their needs. What I would say is that a cryptic pregnancy is a real pregnancy.
Real?
A real pregnancy.
Okay.
In the true definition, like what we mean by cryptic, the only difference between a pregnancy that is every woman is having and a cryptic pregnancy is that the woman that is pregnant is unaware of it.
Okay.
So if a woman has cryptic pregnancy, if she goes to you, test and does scan, you will see it. If I scan, I will see it. If she goes to 20 hospitals and they check,
she'll see it.
Everybody will see it. The fake pregnancy, the first thing they make them do is keep it a secret. And they keep convincing these women that it's only them that can see it.
But then these women look pregnant. Yes. So how do they achieve that pregnancy look? Yes.
So another sad part of it is that they pump them up with a lot of medications that are in overdose, that are not supposed to even be in their system. Just so that one, it shuts down. In fact, some of the medications they give them shuts down their period so they don't bleed. So they tell them, you see, you're not bleeding.
Not bleeding.
And then some of them make them add weight, retain fluid and all of that. So they actually add weight during the pregnancy. But if you've met a woman that has gone through that scam and was able to come out of it, they will tell you that even though they added weight and everywhere was bloated, it is still not the same as when pregnancy genuinely occurs. It's just that when you want something bad enough, you'll believe anything.
Sure.
And I think it's sad that they're like taking advantage of those women by making them do that. Because most women that get to that level that they go for all those scammers, they've tried everything within their capacity. So they are willing to believe any option that is available, so long as they can have a child.
Do they give them steroids?
Well, I don't like to mention medications, but it's been listed among those things that they give them. They give them steroids, they give them hormones as well, just to simulate that it's a bit like pregnancy. They do give them medications.
Are there any long-term effects of these medications?
There will be long-term effects of these medications because, again, pregnancy is about 9 months. Some of these scammed women that have been told they had all this fake pregnancy.
Yes.
Some actually carry them for years. You actually hear them saying they were pregnant for 10 months, 13 months, 15 months. So that means whatever medication they are giving them, they're actually giving them for a prolonged time.
I've seen one that said she was pregnant for 2 years.
Okay. I've seen some along that time. No, it's sad. It's not really funny, but I totally understand. So number one, it's not regulated because it's done in secrecy. We don't even know the dose that they are loading these women with. And we know that women, we have our lives very hormonal in nature. So a lot of things happen. So even for women that have had cryptic pregnancies or the fake pregnancies rather, have we followed them up to even know what has happened to them after all of this have been done to them? So it's a sad thing for me to see when I see that they've taken advantage of a woman or a couple in this manner, because really there's no good that comes out from it. No good. And also remember the fact that it's a fake pregnancy means that you don't even know where the baby they brought to you is from. You're not pregnant.
Wow. So let's talk about having babies. How much of the responsibility, that's the best word I can think of, actually lies on the woman when it comes to having babies?
I like the fact that you said it was couple. As you know, a woman can't give herself, she can't knock herself belly. It's a man that will impregnate her at the end of the day. So if it's a man that can impregnate a woman, then it should be 50-50. However, recent studies are even beginning to show now in science that some of these medical conditions that women even have in pregnancy is a reflection of the quality of sperm that the person that impregnated them has.
Hey, wait. I want you to say it again another way. Or can I say it and then it looks like, if I'm correct, you tell me.
Okay.
So what you're basically saying is that the quality of the pregnancy is majorly dependent on the man.
Yes.
Emeka, you can see that the quality of the pregnancy actually depends on you. So, but why have we been trained to think that is the woman's problem?
Well, I don't think it's training. The evidence of a successful pregnancy is seen on the woman. So it's like logical. Like, that's who you look up to. Like, well, her tummy is not coming out. She's not had a baby. So, but you know, even we as doctors, we now say this couple, they are experiencing infertility. We don't say this woman, because both partners have to have the capacity to make a baby. So that's why the person that carries, you know how they used to joke that it's the person that passes, that knows book, that kind of thing. That's how the pregnancy thing is as well. Once a woman is pregnant, you've achieved pregnancy as a couple. If a woman is not pregnant, the woman is not pregnant. So it's not, I don't think it's like conditioning. I just think it's because it's women that bear the pregnancy. That's why women are usually judged based on by that.
Do you think that infertility has risen in the last couple of years?
Yes, infertility has risen in the last couple of years, and it's due to multiple reasons. Again, our lifestyle has significantly changed. How we live now is not how we used to live before. What we eat has changed. I mean, even for us, like this is not what we ate that we are feeding the next generation. It's not even the same thing. Food items that used to be celebratory food, they are now everyday food. I don't want to mention products, but you do some food and eat some food every day.
Yes.
Even though in those days we used to eat it only during Christmas or maybe birthday. So life in itself has changed. And even as technology is advancing, that we're all happy and we're developing, is also changing our hormones as it were, both male and female hormone.
So let me interject a bit. You said hormones. And especially now when you go online, there are too many people saying different things. Some people say perfumes cause infertility. Some people say fragrance. Another person says underarm roll-on. Do these things have any effect whatsoever on fertility?
So this is a dicey question. Because it's not black and white. It's not like if you use perfume,
you're not going to have babies.
You're not going to have babies. Exactly. Because there are people that love perfumes and they have like 20 babies. However, there's something called endocrine disruptors. I think I'm trying to use some minor terms, but there's something called endocrine disruptors. And some of these things that we mentioned, roll-on, perfumes, they have been implicated in having the capacity to modify how our hormones respond. But it's not to say that if a couple, if they're having infertility now, if they stop using perfume, they're going to automatically get pregnant. It doesn't mean that's how it works. But they have been known to contribute to the ability of people to achieve pregnancy. So yes, people have mentioned them. It's not directly like it's the sole cause. But let's say you're having delay in achieving conception. Those are things you can look at as modifying to improve your chances.
PCOS. If PCOS is so common, how come it's been undiagnosed for a couple of years? Do you have any reasons or pointers as to why?
So PCOS is common, but because the reason why most women with PCOS come to the hospital is either because they are not seeing their period or they are unable to achieve pregnancy. That was why they didn't used to diagnose it in those days. And let me explain this.
Okay.
So most women that have PCOS, they sort of find out in their late teenage or early 20s, even some in their 30s. In those days, quite a number of women were already married. And in fact, some of them started having children before the symptoms of the PCOS started. In fact, if you ask some women in retrospect, they're like, my period was always irregular, but women that finished having children at 25 or 26, if I'm not seeing their period for them, they were like, good for me. I don't even want to have more children. So again, that change in dynamics actually allowed a lot of women not to be diagnosed of PCOS. Because again, reproduction was starting a bit earlier at the time. Also, secondly is, while they were not diagnosed, for a lot of them, they ended up developing the complications of PCOS along the line. So remember that for most women with PCOS, if you don't do anything, most of them in their 40s, at least 50% of them, they'll be diabetic, hypertensive, have cholesterol issues. But these women ended up having them as well, even though they were able to have children. And maybe by the time they were not seeing their period, they were not bothered anyways, because they were completing their families or they had completed their families. So it was always there. But what drives people to the hospital did not matter so much then, because they've already started building their families a little bit early. So it's always been there. And then, of course, it's more now, just like what we talked about, changing diet, changing lifestyle. Things are changing and more conditions are becoming more prominent. So it's also helping. But it was there in those days too. And for even ladies that have PCOS, when they ask their parents or aunties, they're like, oh yes, I've always had a regular period, but I was even happy for it, because that means I don't have to bother with pads. I don't have to bother with, taking care of my period. But it was always there.
Can PCOS be reversed naturally?
PCOS symptoms can be improved naturally.
I see where you're going to. You did not say PCOS. Oh yeah, can PCOS be reversed naturally?
You're trying to set me up.
No, I'm not.
You're trying to set me up. I refuse to be set up.
Don't worry, let's just let you
Okay, the reason why I don't want to use the term reverse is that I have seen women that have controlled their PCOS very well and then they stop. And then the PCOS comes back. So that's why I've now stopped using the term reverse, because it feels like when you say something has been reversed, it's been changed.
Gone.
It's
totally
gone, exactly.
Healed.
Yes, healed, which is possible. But it's to know that it requires sustained pressure. Yeah? You can't take your foot off the pedal, right? So even when you have successfully reversed the PCOS, those same steps that a woman took to improve her PCOS symptoms, she has to continue.
Stay on it.
Stay on it. Like apply pressure. Like you have to consistently apply pressure.
Okay.
So yes, but a woman can basically reverse the symptoms that she comes with PCOS. But she has to, whatever intervention worked, from lifestyle modification to weight loss to whatever worked for her. And sometimes they need medication in between. You have to continue to do that.
What are some of the lifestyle modifications that a woman with PCOS, some, not all.
No, some.
If they want, they can come and meet her in the hospital. But what are some of the lifestyle modifications that a woman with PCOS can take to improve the symptoms?
So it's feeding and exercise. Now I use the word, you see I say feeding and exercise. I'm very careful to not mention the word weight loss outrightly. Because one of the things I've seen in practice with a lot of women with PCOS is the body doesn't respond to weight loss interventions the way it responds in a woman that does not have PCOS. What do I mean? The woman that has PCOS and the woman that doesn't have PCOS, they are doing exactly the same thing. They are eating the same thing. They are going to the same gym. They have the same instructor. Their weight loss is usually not the same.
So is it harder for a woman with PCOS to lose weight?
Yes, it's harder. And that's because the weight gain was never basically about the food. It's the fact that the way their system is processing a lot of things encourages weight gain. So when I say lifestyle modification, it's a combination of food and the type of exercise that you do.
So basically what you're saying is it is harder for women with PCOS to lose weight than women without PCOS.
Absolutely, it's harder.
Why is this so?
Because the weight gain was never about food, not having exercise. It's actually part of the process that the PCOS manifests with. We call something insulin resistance. So a woman that has PCOS metabolizes or breaks down food in a different way from the way that a woman that doesn't have PCOS does. So that in itself impacts how they lose weight. For our PCOS women now, it celebrates 0.5 kg as if it's like one kind of massive weight loss, because we know that for you to achieve that small weight loss, you fought, you've done everything. And then it's also important to know that some of what women without PCOS do and leads to weight loss can actually even lead to weight gain for a woman with PCOS. So I always say that if you want to lose weight, if you're doing lifestyle modification as a woman with PCOS, you will need to speak to a dietitian, nutritionist, and you need a fitness coach, because they have to curate what works for you. And you also have to give yourself time and grace.
Fitness coach. I don't want to just pile on all the fitness coaches, but I feel like they also have to go to fitness coaches that understand.
Yes, exactly.
PCOS.
So maybe that's what I say. A fitness coach that has knowledge on weight loss for women with PCOS. Oh, absolutely. That is actually
because this just appears give you weight and say here,
and then I've seen it, and then they come and like, I'm doing the here. I'm like 5 kg heavier now. I'm adding weight. I'm not losing. So I've seen that. So it has to be, even the nutritionist, the dietitian, they have to be people that have knowledge on PCOS care plan. So it's not everybody. Everybody specializes in one thing. You can't be jack of everything. Even as a fitness instructor, weight loss, whatever your level or whatever your area is, make sure it's someone that has focus on PCOS.
Can contraception cause infertility?
So you are catching me off guard, though. Sorry. No, you know what I'm saying? You're catching me off guard.
Crazy, yeah.
No, I totally agree.
Yeah.
The reason I'm saying you're catching me off guard is that I'm always very skeptical about talking about contraceptive, because everybody is looking for an excuse not to use contraceptive. So if you just mention one thing like this,
everybody hold on.
Even the doctor said we should not use contraceptive, that we'll not be able to get pregnant. By the time multiple people are telling the stories, the doctor said we can't use, Dr. Nonso and Dr. Lewu have said we should not use contraceptives. However, jokes apart, I don't want to use the term that contraceptive can cause infertility. I rather say some contraceptive return back to fertility. Each is different with different methods. And that's why, as a woman, if you want to go on contraceptive, you have to ask the right questions so that you make the right choice.
What are some of the right questions?
So the right question will be, I want to use this contraceptive because I don't want to get pregnant in the next 2 to 3 years. I don't want to get pregnant in the next 10 years. I just don't want to get pregnant for 6 months.
Okay, so that means before you even get into using contraceptives, go in with a plan.
You should go in with a plan, or you should speak to a contraceptive counselor, family planning counselor.
Because that can help you plan.
That can help you plan. Because I've seen women that said, I went to go and take this particular family planning, and then I now stopped after 3 months, and I've not been able to get pregnant for 1 year. The truth is that some method, it takes about 1 year for it to wear out of your system. So again, some you say, okay, we use it for 1 year, 2 years, 3, 4 years. Like you use it, and then it takes a while for your fertility to return, and they now say they have infertility. So if you ask a woman, like, she'll be like, don't use contraceptive. When I use it, it took me almost 2.5 years to get pregnant.
And I've even like 1 year. Yes, and some health workers are even on that same side too, simply because they don't understand this.
So when a woman discusses with you that I just want something for 6 months, what we offer is different. I want something for 1 year. I want something that if I remove it today, next cycle, I want to get pregnant by my next cycle. So that sort of influences the choices. So I don't really want to say it causes infertility. I just know that if you're not informed, you can pick a wrong choice for yourself. So the ideal thing is to cancel, know all the options, know what you need, and then come to a middle ground and then pick the best choice for you.
Which now brings us back to emergency contraceptives.
Hey.
Yes. Hey. We were definitely going to talk about it.
I know.
From Plan B to the one that is very popular in this part of the world. We don't take it when there's emergency. Because what they taught us in school is emergency contraceptives are usually taken during emergencies. Emergencies like condom broke, you forgot to take your pill, something shall happen.
Yes.
But you see people, before they even go for the appointments, they've bought emergency contraceptives and kept in their pockets. Is there any long-term effect of people abusing emergency contraceptives?
For a lot of women that have abused emergency contraceptives, the first thing they see is that the emergency contraceptives fail. Yes, so that's your first collect.
So that emergency can become an emergency.
It can become a real emergency. The emergency you're trying to prevent now emerges. So it can happen. So because by the time you keep using emergency contraceptives and you scattered your whole cycle, it is very difficult for the emergency contraceptive to work as it's supposed to work. So that in itself can happen. You see a lot of women say, I used this thing for like 2 years, so nothing happened. Then 1 year like that, I used it, everything scattered. So again, that in itself can be a challenge. Secondly is that if you keep abusing it, your cycle becomes irregular. And then, with a regular cycle, you don't know when you're ovulating, when you're about to menstruate. In fact, some of them start seeing too frequent bleedings. They don't know which one is period, which one is... and then even that pregnancy that you're scared of, you now start testing, like, is there something wrong with me? I'm bleeding. Some even, after abusing it several times, they now start coming to the hospital. And he says, I used it for a couple of months. Now my period has become irregular over the last 6 months to 1 year. And again, all these things, you shouldn't just bombard your system with it. You're absolutely correct. It is for emergency situations. But we find out in this part of the world, so women are consistent. They are constantly on emergency contraception.
Yes, they're always on emergency.
They're on it. So if they use it, if they have an unprotected sexual exposure today, they use it today. If they have it in 2 days' time, they use it. So that's not how it works. And after a while, they say it fails or maybe it disrupts their cycle.
Can sexually transmitted infections affect a person's ability to give birth?
Yes. I'm going to answer this one.
That's why you're fast.
Yeah, I'm very fast. It can really affect a person's ability to get pregnant.
So STI that a person had years ago can affect a person's ability to give birth now?
Yes, it can.
How?
Okay. So first, one of the leading causes of infertility in our own environment is something called tubal factor.
Wait, tubal. What is tubal?
Let me explain.
Sure. I think I have something here.
So for a woman to get pregnant, see, I'm excited about this thing. Yes. For a woman to get pregnant, there has to be healthy sperm. First, let's be clear on that.
Okay.
So let's assume that the sperm is healthy. There's the vagina where the sperm travels through. There's the womb inside this place that's the uterine, but we call it womb, where the pregnancy stays. Now you look at these round, nice-looking things. That's the woman's ovary. So that's where we make eggs. So I like to say we're like chickens. We lay eggs every month. Okay. That's what we call ovulation. And when that egg is made or laid or ovulated, this tube is supposed to pick up the egg and the egg will now relax here.
Okay.
So the sperm will come up here and meet the egg in the tube. So these STIs we're talking about, if a woman has sexually transmitted infection, it can come in here and come to the tubes and damage it. So you have people say, oh, my tube is blocked. Infections can block this tube. So what it means is that even if the woman is ovulating, the egg cannot get to the tube. Even if the egg gets halfway, the sperm cannot get to the egg. That's for the female perspective. Now, for the male, those infections can also damage the tubes. The vast difference for men, that's what carries their own sperm. And can even go and damage, if there's infection around the testis, where the sperm cells are being made, it can damage it too. So I'm very particular about it because I say for young people, if you're sexually active, one, you must even know your own status by checking up regularly. And then if you have a new partner, I know you love each other and all of that, but these are consequences.
So you're saying that love is not enough?
No. Love cannot stop STI. Okay. Love cannot stop STI, please. So it's very important that if you're sexually active, you know your status. If you have a sexual partner, your sexual partner should also know their status. So STI is really, and we're even having like a resurgence. We're having more STIs now. Yes, so that's why you see me now pepped up about this. Please know your status, know your sexual partner status as well.
Still on the topic of sexually transmitted infections, who catches STIs easier, the man or the woman?
I'm going to answer you, but I'm just telling anybody listening to this, you cannot gamble just because you think one person has a higher risk than you. Now, but because of anatomy, just the way we are made or created, women have a risk of contracting infections faster than the man.
Why?
So,
do you want this?
No, definitely doesn't. Okay. No. I don't need that for that.
Okay.
So women have, so like I said, anatomy. One, even the length of the vagina, even the length of where our urine come out from, what we call the urethra, and even how close where we pee from is to the vagina where sexual activity happens for us. It puts us at risk. And also, there are, I don't want to use mucosa cells. I'm trying.
Don't worry. When you say it, I will explain.
You were saying yes. Okay, so even the vagina itself, the inside of it, it's easily bruised, even during sexual activity. So if there's any cuts there, even infections can ascend from there. So just based the way we are created anatomically, the fact that the opening of our womb, there's a small hole there that still goes in connecting all the way up.
That's the cervix.
The cervix. So it puts us at risk of, women more at risk of infections than men.
Are there symptoms that people can look out for, or does it not come with symptoms at all?
For some, they don't have symptoms. In fact, men luckily tend to have symptoms more than women. So a lot of men, when they have STIs, itching here, discharge there, they are quick to seek care. But sometimes women, like you said, it can just disappear. And sometimes when it disappears, it's not that it's gone. It's just like it has gone up. Like this image has gone, so it's now...
It has ascended.
It has ascended, that's the word. So it's not always that it has symptoms. And that is why it is important to know your status. Because if you are waiting until you have symptoms before you check, then sometimes the infection has gone on to even damage the internal organs, like the reproductive organs. Whether you have symptoms or not, and you are sexually active.
Okay.
And you don't know your status and your partner's status, and you don't know your partner's partners.
Check.
You check. I hope.
So I hope that this is clear to you. If you're watching this and you live in Lagos, please be sure of your own first, and then be sure of your partner's. Shall just use this information and make the decision that you need to make. We can't say more than this.
Absolutely.
Yeah. Let's go to some of the questions that a lot of people have asked, right? And I'm so grateful that you're here to answer some of those questions. Does stress stop periods?
Yes. Stress does disturb period. And that's because of the impact of stress on our hormones.
Okay.
Because again, it has to be in a particular balance for us to ovulate and menstruate accordingly.
Okay.
So stress does stop period. Even from my own medical school, I can remember that during exam periods, most of us, the period will disappear. When you are reading, you're not eating well, you're not sleeping right. So yes, stress can make you not see your period.
Okay. Another question is, can childbirth change the size of the vagina, or does it return to normal after birth?
You say you annoy me now. It's the fact that you're saying return to normal. Was it abnormal before?
It's not me that ask it. It's people online that ask it.
Okay, so there are changes that happen with different events in a woman's life.
Okay.
And childbirth is one of the important events. Now, there's this word that we'll be saying that the vagina is elastic. Yes. It's not inelastic. It's not like some... I mean, if you look at the size of the baby that comes out of the vagina, if it was not going back to its pre-pregnancy size, then picture a woman that has had that baby like 3, 4, 5 times. Then it should continue to be in that shape.
Yeah.
But there is also one important thing that even apart from having a child, being pregnant in itself, whether you do vaginal delivery or you do cesarean section, because I've seen women say, I don't want my vagina to expand. So because of that, I want to do a cesarean section. The fact that you have carried a pregnancy, those muscles that are also the ones responsible for keeping the vagina in shape also get stretched. So for a lot of women, that's why they can say, oh, there's a difference in their vagina, especially at the entrance. They say maybe it's wider, they feel it's wider. And that's why we talk about pelvic floor exercise. So it's not only just the birth, even the fact that you carried a baby that is like 3 kg, 4 kg with all the water and everything. Look at how beautifully enlarged we look when we're pregnant. All of that changes or affects the muscles around there. But with pelvic floor exercise, it improves the firmness or return back to pre-pregnancy state. So I will not say abnormal.
You will not say abnormal.
Yes.
Thank you very much. So you guys have heard it. People that ask the question, it's not abnormal. Yes. In your experience, how many Hebrew women have you delivered?
Every woman I've delivered is a Hebrew woman. I mean, whether I delivered you from your stomach or from the vagina, when a woman and a baby goes home healthy, yeah, in fact, Hebrew woman and Hebrew baby.
Because in this part of the world, we don't even want the doctors to be involved in the delivery.
Yes.
Say, I'm going to have a Hebrew delivery.
Yes.
In your experience, what do Nigerian women mean when they say, I want to have a Hebrew delivery?
Oh, it's simply vaginal delivery. And that's because because the way we ask women is, did you have a normal delivery? So that means by default, the opposite of that delivery is an abnormal delivery. And of course, there's a biblical verse that promises a Hebrew delivery to Hebrew women, which is safe delivery. So when they mean that is that I'm having a vaginal delivery, and that's it. So it's not like, it's not meant from a place of harm, but it's just because Hebrew women is simply vaginal delivery. But there are women that cannot have vaginal delivery.
What kind of women cannot have vaginal delivery?
And so, or some pregnancies cannot be delivered vaginally.
Okay.
So for some women, if it's that they are pelvic floor, their pelvis, right? Like for some women, if their pelvis, a baby cannot pass through just by the shape of it. The bone that the baby is supposed to pass through, the way God created, a baby cannot pass. I've seen women that, and this is very important because I've seen women that have forced themselves to have that. They lost the baby. They still ended up having a cesarean section for a dead baby. So that baby will still not come out if you are that kind of woman.
Because of the shape of the bone.
The shape, yes, of the pelvic bone. For some women, it's that they have medical conditions that is not going to allow them to be able to go through the process of labor. Some cesarean sections are emergency. The baby is not doing well. The mother is not doing well. We need to get the baby out so that the baby can have a chance of survival. We need to get the baby out so that we can take better care of the mother. Sometimes the baby is big. Like the baby is too big to come out through the vagina. Sometimes the baby's position is not compatible with a vaginal delivery. A baby that is, we call something compounded. Some babies, their hand like this. And you know, if it's the head helps to make way for the body to come. But some babies, the way they are lying is even sideways. So nothing to come down. We've still seen women that will say, is that Hebrew delivery
that they must
or
have?
Nothing? And those ones are disastrous because I have seen those that lost the baby. Some even lose their womb in the process because it's not just that they pushed, they tear their womb. And sometimes you have to make the call to save the woman, but you remove the womb. So they can't even have other children. I've seen a few of women that have had that when I was still working in government hospital, where you have to now take out the dead baby, take out the womb just to preserve the woman's life.
Wow.
And some of them don't have children, and that's the end.
I'm going to ask something that looks like a stupid question.
It's not.
Can a woman sign her consent form? Let's say she's going for cesarean section. Can she sign her consent form by herself?
Absolutely. The woman can and should sign her own consent form. So long as she's alert, she's conscious, yes, she should sign a consent form.
But Nollywood has painted a picture that if it's not my husband that signs it, then why do you think that's the case in this part of the world?
In some norms, in some culture, major decisions are made by men. So if this feels like a major decision, and that's why a lot of couples, they defer to their husbands. But for most couples, they've discussed this. Sometimes the husband is not even around. Or sometimes you come for antenatal, you didn't even think you're going to be delivered, and there's something happens and they need to deliver you that day. So I think for couples, they should have that discussion. If you know maybe you're from that culture that says it's a man that should sign, for men watching, let your wife know that she can sign. She doesn't need to consent with you. So I'm not there. You need to sign this consent for your health and the baby's health. Please sign. And of course, even if it's not cesarean, generally, if you're having any surgery, the only thing I will ask that you insist on that it has to be an informed consent.
Yeah.
Not that they just come and meet you and say, Madam, sign this, we want to operate you. Someone should educate you on the surgery you're about to have, why you need to have that surgery, no matter how short. That consent should be signed after you've had a bit of information about, of course, depending on the level of urgency, but yes, you should sign it. A woman should be able to sign her consent herself.
Some people wait for their pastors to sign.
Again, so those
have you seen anything?
I've heard and I've experienced. I've experienced a lot of that. Again, it comes back to who do they defer authority to in their lives. So it could be that it's the pastor. Like if they want to make any major decision, maybe they consult with their spiritual father.
Leader, yeah.
So what I've also seen a lot of pastors do is if you call them and say they should sign, the pastor some will say on the phone, can I speak to the doctor? Please do what you need to do. Again, it's you also making sure that power doesn't stay with you. Earlier in my career, I'd seen a lot of women that before you even want to make decision on delivery, say, let me call my pastor. What most amazing pastors do now, they say, we'll pray with you, but whatever they are doing in the hospital, let them do it for you. But some people do it.
So we'll leave with one last question before we go. And this has been a question that's like top on the list. Can taking pain medication stop a woman's period? Especially NSAIDs.
Okay, so shout out to NSAIDs for the role they've played in women's reproductive health. But yes, NSAIDs can stop or significantly reduce a woman's flow. So why do people use NSAIDs and I'm not mentioning particular brands.
That's fine.
People use it when they're having menstrual cramps. That's for pain.
Yeah.
And people use it even when they're having heavier than usual flow. So yes. So we prescribe it in some cases, but of course, a lot of people abuse it and buy it over the counter. So yes, NSAIDs can significantly reduce or in some shorten, even some that have prolonged bleeding, they use it. There are some that we prescribe that women use slightly before the period starts, just to sort of control the degree of bleeding that they have.
Do they have any effect on a woman's ability to give birth?
So I would say it can affect a woman's ability to achieve pregnancy.
Okay. NSAIDs can affect.
Okay. Now, remember that I say it's not 100%. But there is the process of producing egg that leads to ovulation. Think about the normal egg that we eat, right? Remember, we crack it. So even as a woman, when you're growing the egg, you're going to ovulate. At a point, you're supposed to pass the egg out so that you can get pregnant with. NSAIDs have been known to disrupt this process where the woman finds it hard to actually successfully ovulate. So for me, if I see a woman that is trying to get pregnant and of course you are checking her and you want to know if she's not using NSAIDs around those times, because if she's using it for pain or she's using it for another pain somewhere entirely different, it may be disrupting her ability to successfully ovulate. So again, that's now making pregnancy a problem.
I know I said last question, but just forgive me.
So
one last question.
Okay.
One last question. Are miscarriages in the first 3 months a woman's fault? Yes.
I'm taking a breather. Please, I don't like the term fault.
That's why it's not me that asked the question. It's the people that ask the question.
Okay, all right. So half of miscarriages that happen, we never find what caused it. In fact, one of the teachings we learn very early is that sometimes it's nature's way of sorting out pregnancies that are viable and the ones that are not. So something was already wrong with that baby from conception. And so in a way, the body rejects that pregnancy.
So what you're saying is, if it did not form well, the body can naturally take it out.
Yes. So that's about. So in half of the cases, if we can look for what caused it, nothing can explain it. Now, not using fault, but there are things that can predispose a woman to having miscarriage, and it's very important for women of reproductive age to take note of that. I know if a baby is abnormally formed, remember all this folic acid we're always talking about is to reduce the incidence of some of these abnormalities. Right? If you're taking herbs, if you're taking a lot of alcohol consumption, and this also
herbs can affect the quality of a pregnancy.
Yes, because again,
that's agbo nishe,
agbo, everything, and even some prescribed medications.
Yeah.
So some that you're using it to treat something else, but it may not be safe for you to conceive. So for a woman that is pregnant, so it could go from agbo to gbogbo nishe to prescribed medications, because some of them affect how the baby. So all these things can affect, of course, and then it depends on the type of work you do. If you didn't know you were pregnant, you are still moving up and down, it can negatively affect infections and also compromise what keeps the pregnancy in there and lead to miscarriage as well. So, and a metabolic disease like diabetes, poorly controlled blood pressure, all of those diseases that we kind of commonly talk about, if it's not well controlled, it can lead to miscarriage. So it's not a fault thing. It's just that it's better for a woman to optimize her health before she even gets pregnant.
So you're saying you even need to be healthy before you get pregnant?
You need to be healthy, and your partner needs to be healthy. Yes.
So thank you so much, Dr. Abosede, for being on Unclog with Aproko Doctor. It has been an enlightening conversation. Your English is even starting to affect myself. So, but thank you. I'm sure the Emekas and Nkechis on this side of the screen have learned a lot. You have broken down a lot of the issues that many of them have been facing. But I'm sure some of them want to find you, right? Because this time we spent is not enough to answer all the questions they have. So where can they find you?
Okay, so they can find me online and they can find me in person.
Where can they find you? What's your address online?
Online. So they can find me on Instagram, X, as Soft Life Gynae. I knew you were going to do that. So just the way you think about it, Soft Life Gynae. And then I'm also the medical director at Old Women's Clinic in Antony Village, Lagos. So that's where I physically consult. And,
we would put the link somewhere down on the screen so that people can.
Don't worry, I won't put our number so that
you won't put your number. So link and number down on the screen. Reach out and get the help you need. If you've watched it up to this point, congratulations. It shows that you're important, that you are interested in your health enough to actually pay attention to the information that's been going on here. Some people stopped at 5 minutes, some people stopped at 2 minutes, some people stopped after the trailer, but you continued to the end. Some of you started from the middle and got to this point. Whichever point, just congratulations on you. Don't forget to like, don't forget to subscribe, don't forget to comment, don't forget to share. The reason is because the more you do these things, the more YouTube thinks that our content is important enough and shows it to more people. So if you don't want to send it to your neighbor directly, just like, comment, and share. YouTube will show it to them. Thank you very much for being a part of it, and I'll see you in the next episode. And as always, my name remains Dr. Chinonso Egemba, otherwise known as Aproko Doctor.